Okay. Hi, welcome everybody. Kim and Elizabeth with Heartland PMAD Consultants in St. Louis, Missouri. And I'm Elizabeth Louder. I'm here with my partner, Kim Martino Sexton. And I'm going to let Kim introduce Debbie, since you guys have a really good working relationship. And this is I have the pleasure of meeting Debbie for the first time on this Facebook Live. So thanks for joining us.
Oh, good. I'd love to.
Hi, everyone.
Good morning.
Welcome, Debbie.
Hello.
Hi. Well, I'm really excited that Debbie is able to join us this morning. So hello, everyone. I'm a little preoccupied, so I'm sorry, trying to get my phone to show me Facebook so I can see if we have any questions. So that's what I was looking down doing. But Debbie, I'm so glad you're with us today. So Debbie Scheff, who is a nurse at St Clare Hospital, started working with our moms groups. Is it, how many years, Debbie? Is it 2 years?
Yes, it's 2 years. I can't believe it, but yes.
Went by quick, right?
It did, yes. Oh, yeah.
So Debbie is one of our, is a perinatal childbirth educator at St. Clare Hospital, as well as one of our moms group co-facilitators. And we're just excited to have you here with us today to talk about like the state of what's happening with moms that you work with. And so we've had to make some pivots. Our in-person moms groups back in mid-March, we had to switch to moms group calls. We still co-facilitate those calls and still have moms calling in, and we're supporting moms that way. And then Debbie, there's been some changes to childbirth education that we want you to share with us, kind of what the pivot was there for childbirth education at St. Clare. And then also there's an exciting newer thing that Debbie's doing to support moms. And so we want to hear a little bit about that today too. And so Debbie, welcome.
Well, thank you. I'm glad to be with you this morning. Yeah. Well, so yes, there are changes in the childbirth education world. We've gone from certainly, face to face and PowerPoints and being with the moms and the dads during their classes to all e-classes for the couples that sign up for their childbirth education. So each of the childbirth educators at SSM, find out who, has signed up on the roster for e-class, and then they are notified. We call them and set it up so that we can call them, every other week or once a week to check in. Are they able, they have questions. There's always a lot of, I don't understand it. I do get all kinds of calls. So that's the process. So each of us have our own moms that we call every couple weeks. So that was going on, and it's going on well. At one point, Kim and I had a conversation, probably more than one, about what about the moms that delivered? Now they're home now. What about them? Because oftentimes moms would come to our mom support group at St. Clare because they went to weigh-in Wednesday, which was every Wednesday, 10 o'clock to 12, if mom had issues with breastfeeding. They would come in and they would weigh baby, with the nursing staff, and then they would feed the baby and then weigh the baby and be able to show mom, the baby is getting so many ounces. You are doing a good job. But oftentimes after that, well, the second and fourth Wednesday of the month at 12:30, we have the postpartums, the mood and anxiety disorder group. So, which is a big group at St. Clare and has been as long as I've been there and before. And those moms that were at weigh-in Wednesday oftentimes stay and come join the mom support group. So that's nice, but of course, right now we can't do that because of COVID. So Kim and I brainstormed and actually put a plan together that we were able to start a pilot program at St. Clare for all the moms that delivered in, we're doing April and May. I'm calling each mom that delivered at about the 3-week point, and just having a conversation with them that I tell them, what resources we have, go through the Edinburgh, the EPDS-3 with them. When we have our normal moms group at St. Clare, we do the whole Edinburgh postpartum depression screening tool. So go through all of that and exchange phone numbers, and yes, it's been amazing. We're also able to send brochures by an app that we have at St. Clare. It's the Patient Education Genius app. So I have to say I've sent over, at least 300 brochures to people, that follows up where they are now. When we talk, I do certainly talk about the mom support group, and they love it. I had one the other day, her 4th baby, and she knew all about it. She must have been in the group a few years back. And so send her the new number. So our director, Angela Filipiak, was like, let's do it. Let's do this pilot and see. So that's how it all got going.
And so what are you hearing? It's so exciting.
It is.
It's not exciting, and it is exciting. I'm sad that we have to send moms home so quickly after their deliveries, a little faster than we were doing at sometimes. And I'm sad that we don't have our groups in place for them to come to, whether it's a weigh-in Wednesday, a breastfeeding support group, or lactation support group, or our moms support groups, or any groups for moms to go to at any hospital these days. But it is exciting to be able to put the program into place. And Debbie really, took the lead and pushed pulled it all together to meet the needs of our moms and let them know that we are here for them. Because that's what I think is key, and what we were, worried about, and we still worry about moms, going home, and they're so focused on trying to stay safe and healthy because of COVID. And then they're also a little more isolated than we've ever been. And so I think having that reach out from the hospital is so important, to let them know that, hey, there's still folks here thinking about you, and to let them know that we've got these different ways to support them virtually. So what, and so Elizabeth, as you're hearing all of this for the first time, like some of the things that we're doing, I know I have some questions, and one of my things that I was wondering about, but I'm interested to hear from you too, Elizabeth. My question for Debbie is so what are you hearing from the moms? How are they doing?
Well, right away, they're very surprised. Oh, oh, you're from the hospital. I get that a lot. And then, you know, I have a script that I follow, asking them, you know, some questions. How are you? How's baby, dad? You know, all of that. But they're just so, all of a sudden questions just pop out, you know. They'll tell me all about their doctor visit, how baby's feeding. Oh, definitely they talk about sleep, or not sleep. And then, as we do in the moms group, you know, make a few suggestions of what they could do to, you know, get some sleep. When I would teach the classes live, I always ended it, the postpartum part, about putting up, you know, what can you do? What, when you go home, you know, think about this for dad's jobs and think about this for mom's job. You know, mom has to feed the baby and dad's pretty much got to do everything else. And we actually have the class say what chores they'd like them to do, what support people can come over and take over, maybe one a day for 2 weeks, that they can get their sleep. But you see, with the COVID, that's not possible now. That you know, to have bringing people in the home and, you know, in the middle of a pandemic is probably not the best idea. And oftentimes the people that would come are in the vulnerable area regarding, you know, COVID. So those are the things that we start talking about on the phone. I noticed that moms get, well, you know, you can tell when somebody's getting a little anxious on the phone if they're, you know, talking real a lot, and, you know, those kinds of things. The more that I listen, the more comes out. So that, I guess I was surprised that they were as verbal as they are. But, you know, that's a sign right there. We got some stuff going on.
Yeah. Do you find them to be more talkative now that you're doing online groups, you're saying?
Absolutely.
Yeah, and it must be because
yes.
we're just feeling more isolated and we're like, oh my God, grown-ups that, you know, I can talk to.
Right. And, you know, it's, you know, it's amazing. So, yeah, I mean, I'm glad we really got to start this, you know, and feedback. I've been getting some feedback from some of the, from the nurses at SSM, and they're like, oh my gosh, what a great idea, you know. And I'm just like, yeah, you know, it seems to be going well. So, and I'm sure when we have our second and fourth phone conference, the second and fourth Wednesday of the month, the phone conference, probably are going to have a lot more moms on the line. They all want the mom's line phone number and the mom's support group phone number. So, and of course, I then introduce them to Kim and tell them that she'll answer the phone and that it'll be within 24 hours, which is what she tries to do. I know that. So, yeah. That's some of the things I find, you know, it's almost the hidden anxiety. Yes, everything's going well. You know, whenever they say it's fine, I'm like, yeah, great. But the, you know, the more you listen, I mean, the phone calls can get a little lengthy. That's okay. But they tend to open up more.
Do you think, as a therapist, it makes me wonder, do you think that the moms, you know, that you talk to regularly, Debbie, do they have a sense of like understanding and accepting and like embracing even that they deserve support and that they don't have to struggle all by themselves, or are you hearing the contrary?
Well, Well, some do and some don't.
Yeah, that's
A
fair.
lot of them are still at 3 weeks. I pick up that they think they need to be in charge of everything, that they need to be the one that, okay, we need to go to the grocery shop, do that now. And a little, I don't know.
No, I hear what you're saying. Like, it's difficult to, even if it's temporarily, relinquish some control over managing the household, if that's what mom did before she had baby. And so I hear you saying that, like, also I hear you dispelling a myth that I think a lot of moms could benefit from hearing, in that when we have a newborn, or I don't care, a 6-month-old, an 18-month-old, we can't run everything.
Right.
Like everything, we can't, so delegation is our friend.
Right.
Yeah.
And
but this idea that, like, we have to, or else I don't know if this is always, that's why I'm really grateful to get to talk to you, but sometimes I get the impression that moms feel like, well, if I don't have it under control, or at least give the perception that I have everything under control, then my motherhood is going to be judged. The quality of my motherhood will be judged.
Absolutely. Yes. I think it takes years before they figure out, boy, I don't have to be doing all of this for everybody all the time. It's kind of like, so who are you going to help now? Yeah. But when the light bulb goes on, you all of a sudden see, a calmness that comes over them. It's just, and watching this for 2 years with the moms group at St. Clare, because they do keep coming back. You can see that all of a sudden, well, some, with the help with Kim, does get to a therapist and does get, the treatment that they need. So that's also a big part of it, knowing when to, well, for all of us as childbirth educators, knowing when to say to Kim, I think this one needs a phone call from you, so yeah.
I do think that there's so much about this permission granting, like giving ourselves the permission to ask for help, and not just to ask for help, but to really explore what help looks like for us. Because I think that's part of the issue, is we have this idea of, either we have to be in control of everything, or there are certain things I can ask for help with, but there's certain things that maybe I didn't even explore. And so that permission granting, that, I can just start to think about, what does support look like for me? What kind of help do I deserve? Not just what do I need, but what do I deserve, and what can I ask for? And I think that's one of the things I've enjoyed about the Moms Line programs, is that we're encouraging moms to, like, we're encouraging moms to, Elizabeth's daughter in the background, hi Evie. We're encouraging moms to, to really look at what, and think about what they deserve during this time frame. And what I like about the phone calls, when you're calling them, Debbie, is I feel like one of the things we get to do at the Moms Line, every phone call that we have, or if moms come to a group with us, and the work that Elizabeth and I are doing too here on Facebook, is reminding women that they deserve all different levels of support and all different levels of self-care. And to start thinking about what that looks like. Because I remember being a new mom and thinking that, okay, well, I'm a mom now, so I have to do it all. And somehow I don't know if I was proving, right, I was proving something, or I had to be in control of everything, or like somehow I was going to be a bad mom if I did ask for support, or if I did say I couldn't do this. And starting those conversations as early as we can, we're starting to plant those seeds of, you deserve support, whether that's getting, connected with a therapist, getting connected with a group, getting connected with some community support. And then I think it's even more important right now during this quarantine, when there's so much more isolation and it's so much harder to connect or we're connecting differently, and our connection feels sometimes exhausting. Like, I love seeing you all on Zoom, but it's also so much more tiring to be on Zoom. Like, I feel like, like I'm watching what my face looks like more than I'm paying attention to what, like there's like all this energy into all these other things that I miss just the connection of that face-to-face in person. And so I worry about how moms are doing without, that level of support. So, but it's so
I'm
there
glad
you
you
go.
said that, Kim. And but question from Andrea. But before I ask it out loud, I just want to piggyback off that, and that I've been talking to a lot of colleagues lately about, clinical indicators of support versus typical postpartum adjustment, and how no matter what, no matter if moms qualify for a DSM mental health diagnosis or not, they still deserve support. And that's why, the moms groups and the moms line and all of the childbirth follow-up that your department does, Debbie, is so important, because no matter what, we deserve the support. Sometimes it's clinically indicated to get therapy. Sometimes it's not necessary, but I'm really interested in the attitudes of moms, especially during quarantine, because everyone's baseline just got raised as far as anxiety and depression and trauma triggers. And so if you kind of, I'm talking to a lot of moms and I'm like, if you're feeling like you needed support, in February, you definitely need some support now. And that's okay. Like, it doesn't reflect negatively on your ability to mother. And, right. And I know we know this, and I think the moms know this cognitively, but when we apply it to ourselves, it's very hard to do that, because the definition of a lot of our definition of what it means to be a mom is very self-sacrificing and nurturing and caring for others. But if mom's not okay, no one's going to be okay. So it's really important for mom to be okay. And so I know this week I've talked to a handful of moms, and specifically, at the end of every session, I like to talk about, like, well, what's your self-care plan for today or this weekend, or just get them thinking maybe a day or so ahead of themselves. And what are you going to do for you? And one of the moms I was working with was saying, all I need is time to work out and take a shower. That's all I want. That's all I want, and I'm like, that's great. It's so great that you know what you need. You've checked in with yourself to even just know that, right? Because so many times we're like, well, I don't even know what I need, much less have the time to deliver those needs to myself, right? Mm-hmm. So she was like, I know that's what I need. And I think, like, husband was out of town or something. So she's like, it's really hard to get it this week. And for some folks, it can maybe not feel, they're not at the place where they're like, yeah, I deserve it and I need it, and so I'm going to figure out a way to get it. For some moms, I may find myself kind of taking a different approach and saying, hey, your kiddos need you to work out and take a shower. Like, that's going to be good for your kids, and I'll name kiddos and say they're going to be so happy that their mom got that break. And sometimes
that's so important, like, because sometimes we think that self-care is just for us, but really self-care is for our whole entire family. Like, you taking care of yourself is a gift you're giving to your family members.
Literally.
Yeah. Mm-hmm. It's not selfish. I mean, I know that somewhere in society for so long, we've talked about self-care, or people assume self-care is somehow selfish when you take some time for yourself.
Or God forbid, you're away from your kiddos for a while.
Right. And it's really like, that's a gift you're giving. You're taking a break. You come back re-energized. You fill up your cup. So sorry. I just wanted to, I'm like, no, yes.
I agree. And I just deserve it. No judgment around the moms that may need that angle, but just, I wanted to kind of lift up that, like, sometimes we need to explicitly say, hey, your kiddos who are 5, 3, and 1, God bless you right now. Like, they need mom to figure out how to get that break. So if you can't do it for you yet, do it for them,
Mm-hmm.
I'm going to ask a medical question. I hope Andrea is still with us. And Debbie, let me know if this if you feel comfortable answering something like this. If you've already recovered from COVID-19 and you get pregnant, will the baby develop antibodies? I don't know that. I don't know if we know that.
Yeah, I'm not comfortable answering that. She should talk to her OB, family practice doc, whatever. That's kind of a up in the air kind of thing, I'm guessing about right now.
I don't think we know that yet.
I don't either, but yeah, somebody does. Somebody does know.
Somebody somewhere.
Or somebody has a theory on it. You know, I think that's part of our issue right now is we haven't had enough time to even do the amount of research and testing that we need to figure out what's what. So I feel like there's all this research being done, but we don't necessarily have, you know, exact conclusions. So and I appreciate your answer, Debbie. Yeah, I'm not comfortable because I feel too like I don't know how to answer that.
Well,
we need a team of scientists.
When somebody can say they don't know instead of tell me I don't know any day. Don't make up an answer.
Right.
You know, I respect that to the fullest for sure.
Yeah, I know, because and this morning some of the information about that what do they call it, the plasma, but they have a certain there's a descriptor in front of it, and I can't think of what it is, and they were talking about that, you know, and so it's like, well, if the plasma is helpful in people recovering, then does that mean that we're developing antibodies? But there's nobody answering any of those. I'm not seeing answers to those questions. Maybe I don't know where to look. Maybe I don't know, you know, I don't have privilege to certain types of research that I know researchers do. Right. And so,
there's certain journals that you rely on. Right. And until you see it in those journals, not gonna be saying, call your doctor. Yes. So
I know one of the things that when we talk about this whole COVID thing, we've talked about all the different hospitals have different rules, guidelines for how much support mom can have with her. And so at St. Clare, Debbie, do you know what's happening at St. Clare in terms of is it one support person for mom?
Right. It's kind of like I was talking to one of the childbirth educators yesterday, and I just was like, wow. And there's still, you can have one person, and that's more than likely going to be dad. And he goes in and doesn't come out for 2 days.
Okay.
I mean, it's like, wow. And of course they do wear masks. From what I'm told, they don't have to have the N95. They can wear a cloth mask, but the staff all, you know, to go into that room have to have the proper PPE. So, it is still that way. And slowly but surely things are going to start opening up. You know, don't know when, but I think eventually we'll be back to face-to-face groups. Sooner the better.
Someday.
Yeah.
I have a question based on some of the moms on my caseload at Sage Tree who are currently pregnant. So, and I know you can probably just speak to St. Clare and that's fine. But so moms, when they present, if they're in labor or for their scheduled C-section or whatever's happening, when they present to the hospital, do they get tested for COVID upon presentation?
I'm not sure.
Are they getting screened like with a
temperature?
Sure.
Oh, yeah.
Okay, because some of my clients are telling me that their doctors informing them that they'll get a test the day they're in labor. And then that test will determine if baby gets separated from mom.
And that's certainly something that's happening at a hospital by hospital basis in terms of how they're handling. And that much I know just from, because I'm nosy, so I'm calling all the different hospitals to find out what they're doing. Because when moms call the mom's line, they're asking about
Right.
what's, if I know, and so I keep kind of checking in. And so, so what do you know what's happening at St. Clare specifically around that?
I am not sure, but I'm almost sure they're probably being tested, because you wouldn't want baby and mom together, and it's a
You need to know
the
mom's
whole,
status. Yeah.
right, the whole ball rolling. But yeah, I haven't come out flat and said. I always ask how's how's the corona going, and get the ins and outs. But yeah, I can't answer that.
Well, so one of the things that is coming up for some of my moms on my caseload, and I see that Kimberly has a question, we will get to that in just a second, and it's all related, is the moms I'm working with are experiencing, that have been told that, are experiencing understandably a lot of anxiety about so I'm going to go into labor, which is anxiety producing, or go to my scheduled C-section or whatever it is. They're already activated, obviously, because it's one of the biggest moments of their life. And then they have to find out if they're going to get really bad news, imminently.
Right.
And that's, that's causing a lot of anxiety. And so I've been wondering, well, can we ask OB to test you a week before your due date? Is there any mitigating things we can do to get a test in advance that would assume, have you guys talked about that or thought about that at all? Just to prevent the zing of the day of delivery, right. To know.
Well, yeah, but the thing you got to remember, the testing is on that day. Okay, maybe it is a week before, and that's what it is that day.
That day.
Sure.
You see,
I just wish these poor moms could get tested every week or something in the last month or something, so it wasn't such a surprise, because there's a lot of anticipatory grief over, are they going to separate me from my baby?
Sure. And part of what goes on, you have the corona patients that are definitely positive, and certainly they're in a different area than the ones that are under investigation. Okay, still waiting for response on the labs, and moms go into labor whenever they go into labor, and that's just how it is. And they're well prepared for all of that. I mean, the nurses, the doctors,
because I know,
go ahead.
I know it well at some of the hospitals, and I would love if anybody's watching at some of the hospitals who knows what we're doing today for testing, because I think that's part of the challenge here, is it is changing regularly at each of the hospitals. And so my understanding just last week at some of the hospitals, they were only testing moms if she had symptoms. So if you were if you're asymptomatic, not having symptoms, then it was just the screening that was being done. So, they take your temperature and they're asking the questions, but not testing. And then I found out that one of the things that at one of the hospitals, what they're doing is, if you're getting an epidural, they're looking at your blood cell count. So it's not a COVID test, but they're looking at looking at your blood. They're doing an extra test that they didn't used to do before to see what your blood cells look like, so that they can make sure that it's safe to give an epidural. And so I keep hearing all different things that are happening. Go ahead, Debbie. The white blood, is it a white blood?
Maybe the white blood cell count, which indicates infection.
I think so.
Or platelets even for an epidural.
Maybe
I think it was a white blood cell count test, so that because they wanted to. So I know some protocols are changing, but each different hospital, it sounds slightly different. And I know that not all hospitals are separating mom and baby if mom is positive.
Yeah, and so that's not across the board. And so it is important for moms to be keeping in communication with their OB,
Right.
letting them know what their
With their
concerns are.
hospital.
You know, letting them know. I mean, I'm sure, I mean,
Mhm.
what am I trying to say? Even though it may seem obvious to me that, like, of course they're anxious about that, like, let OB know, I am having a lot of anxiety about, you're telling me I'm gonna get tested once I'm in labor. Is there anything we can do about this? So I'm really encouraging, and my moms tend to have really good relationships with their OB, so I'm not concerned that an OB is gonna respond inappropriately necessarily, but just to encourage moms to have those conversations, because, you know, we have 3 experts right now, and there's not a consistent answer across the board, and that's just in our community of St. Louis. So, you know, education, or not education, but knowledge is going to help us feel better about this. So keep asking those questions to the people that know your specific situation at your hospital. So Kimberly is asking, why would baby be separated versus encouraging breastfeeding instead? Do you have any questions? Do you have any moms asking questions about that? Like if they are positive for COVID and how breastfeeding would work, and separating mom versus not separating mom? Like, what do we know about that?
Well, I really haven't gotten very many calls about that specifically, okay? But I do know that SSM has a protocol for that, okay? And I don't necessarily want to quote it and get it wrong, but sometimes it's if mom has COVID and baby has COVID, depending on the severity, you know, they might end up being together just because of the breastfeeding. Or sometimes baby has to go, you know, to a special care nursery or to a NICU. So there's so many factors that they make that decision about that I don't think, you know, it's a cut and dry. And of course the pediatricians have a lot to say about it. And you know, that's probably the best person that's going to answer their questions, because I don't think it's across the board one way or the other. What
are patients' rights to breastfeed or be with baby while they're in hospital? Like, do they have the right to say, yeah, this is your best advice, but I want to be best breastfeeding my baby? Or like, what, how does that work?
Sure. You know, they will be pumping, okay? So that breast milk is going to baby if baby can't be actually at the breast. So yes, they definitely encourage that. Now, if mom's running 104 temp, you're not going to be saying, now you got to wake up and we got to get this breastfeeding pump thing going, you know. But of course, breastfeeding is like number one of baby friendly, and the, you know, we are big on baby friendly. Mom's gonna breastfeed, we're gonna get mom to breastfeed. That's probably the number one problem or question I get when I call the moms at 3 weeks.
Really?
I've referred a lot, yes, to the lactation nurses to help them along, because at 3 weeks you'd kind of think probably you're setting on your way with breastfeeding. So
if like problems are still lingering after 3 weeks, it might be something that needs, which is so common to have happen. But if it is, it's a good time to get some extra support.
Right. Cracked nipples, or, you know, the redness, the warmness of the breast, the engorgement that's going on. And I had one of those yesterday, actually. So yeah.
Well, I remember I had premature babies, and I didn't have any problems breastfeeding a tiny itty bitty NICU baby until she reached her due date. And, so things like that where the follow-up care, and I think I had
Right.
nurses for newborns or first steps or something. But anyway, having a nurse follow up with me, and it was like, everything was fine. And then she hit her due date and it was like, she didn't like it anymore. So that's good to know. And are you, do you know if any of your lactation consultants at St. Clare are doing online consultations and stuff now?
Well, I know they do consultations all the time. Is it online? Is it over phone? Is it, I don't know if they have it specifically online.
Just based on yesterday
Yeah.
at St. Clare. So right now it's still phone consultations, although they are open for in-person. So that's back. You can make an appointment and you can go in and be seen if that's where mom's comfort level is. And then they are doing phone consults, but not virtual yet. And so, and I say yet, because I think we're all, depending on how long all of this goes on, I think we'll be moving to some virtual practices, but we're still SSM, still working on that here in St. Louis. And so, and I, back to the mom and babies being separated, what I appreciate about the conversations that I'm having with the folks at different hospitals is that it is a case-by-case basis. I mean, there's, like Debbie said, there's so many factors going into how we're making these decisions. And so, just like if we have a baby who has to go to a NICU, then breastfeeding is facilitated in a different way because baby needs to be in a NICU. If both mother and baby, like for instance at St. Mary's, my understanding is if mother and baby are healthy and they test positive, they have COVID, they're sequestered in their own little room with their support person, with the partner, and they all stay there together. Breastfeeding happens, meals are pushed in, like all of this occurs until they're ready to go home. So they're keeping mom, baby together, the whole family unit. But that's assuming that all these different criteria are met. Because if baby needs to be in an Isolette in the NICU, well, that's a whole different, and at the NICU at St. Mary's, then yes, if baby's in the Isolette or whatever they're called, because I'm not going to pretend to know all the names of them, because
good.
I'm not clinical, but so I mean, depending on what has to happen, I mean, there's all of these criteria that everybody's watching, because the goal at every hospital, and I think that it's really important to know that the goal at every hospital is to keep mother and baby together. That's been the goal for many years now. COVID has added this thing, but it's not as if the hospitals are working against us. And I think that to always keep in mind, and I loved this post that it came out when we were first saying that moms couldn't have more than one support person with them, and the discussion was, oh my gosh, mom has to be alone. And it's like, well, mom's never been alone because the nurses have always been there for mom.
Right.
And then, like
on earth. Yeah.
Always there's a nurse with mom. And then always, and then we are fortunate in this area that it is one partner, one support person can be with mom at all the hospitals. And then, folks who have other support people, whether it's a doula or not, they can show up on, a smart device of some sort, a tablet, a phone, so that your mom's never alone. We're not.
Right.
I think that one of the things that across the board where I'm here, all the hospitals, as we're talking about this, it's not that we're locking moms in a room by herself and no one's with her. And so, and once baby's here, it is the main goal is to keep mothers and babies together. I mean, we, all of our hospitals changed years ago in terms of babies being even sent to a well baby nursery. I mean, rooming in is like the thing. And even during COVID, unless there's circumstances that warrant separation, and that would have to be, all I'm hearing for everyone is that they're paying close attention, but that's not the main goal.
Yeah.
So I think that it's important for us to hospitals are not the enemy.
Right.
And
Yeah.
although it can sometimes feel like, oh my gosh,
Yeah.
this is a scary place to go. Most of us who chose hospital deliveries chose it because I wanted to go to where I knew the lifeguards were, if you will.
Right.
So here I'm going to go
Yes.
to where the lifeguards are, because I didn't feel comfortable at home, and we didn't have birth centers when I was
Mhm.
birthing. And so now, there definitely are more options. And everyone, the goal is to keep, mother baby unit together whenever possible, is all I'm hearing everywhere, even at our birth centers.
Well, I probably ought to throw this in right about now. You ladies won't believe this, but then again, maybe you will. So I want to say it was 1976, maybe 7. I can't remember the date exactly, but I was in charge in a St. Louis facility, OB, ER, and OR, and our OB unit opened the first birthing room in St. Louis. Can you just believe that? And here it is coming like full circle.
Yeah.
And you know what? I mean, for a mom to birth in her labor room was one thing, but then to have rooming in, oh my. So it's come a long way.
So that was the first time when babies stayed
Yes.
with mom after
Yes.
delivery?
Right.
Got
I
it.
mean, on the local news, I was a wreck. I mean, I was pretty young then, and I was like, oh my goodness. Oh, I can still remember some of whoever was on channel 2 or 4 or 5. They're still around. Okay. I mean, they're still, oops, there goes my phone. Yeah, they're still around. But yeah, man, that was something. It was a big deal.
Big change.
Big deal, big change. And that's right about the time epidurals came in, because I, with my first child, my son, I did a paracervical and pudendal. You might know that. And then epidurals came in, and it was like, well, I'm going to try this to be able to say I tried it. And yeah, I mean, life just changed. OB changed a lot.
Man, I could just sit and talk to you forever about all the stories you probably have. I think if I hadn't become a social worker and I could tolerate bodily fluids,
Yeah,
I seriously considered going into L&D nursing.
That's where I started. Night duty, St. Louis County Hospital, which was where the Galleria is now.
Oh.
We had a city hospital and a county hospital. And that's where I started. Everybody was grand mal tips. I mean, 6, 7, 8 babies. It was something, but excellent experience.
Oh man, you probably have just a million amazing stories.
But anyway, that's it for the birthing room. There you go.
Well, and
now they're like hotel suites.
Yeah. Now yes, they are.
Sometimes when I teaching, I say that. Well, when you go to the hotel, I mean the hospital. And it's not. It's not.
I remember this food. It's like really good.
Yeah.
It was so nice.
And we encourage them to pre-register. You got to get your room. Get your room. Yes.
Yeah. So, well, I'm so grateful that you were able to be with us today, Debbie, and to talk about, some of the things that, some of the new and exciting things that are happening, and also, even for things we don't have the answer for, I think having the conversation, because just because we don't have the answer doesn't mean we shouldn't talk about it.
Right.
Which I think applies everywhere, and especially when we're talking about maternal mental health. Like, we may not have the answer to what are the exact 4 or 3 or 2 things that are going to help mom feel better, but let's talk about it, because the more we talk about it, we can figure out something that works.
Yes.
Agreed.
Yes.
So I'm just grateful that we're all in the conversation, and encourage everybody out there to continue to be in conversation. And grateful that we have the opportunity with our moms group calls to continue the conversation. And you can always call the Moms Line for one-on-one conversations. We've got fabulous therapists in the area and nurses in the area who are willing, everybody's willing to have a conversation.
Yes.
And, let's explore and wonder about, what it means for us to, really get the care we deserve as moms. And so thanks for being with us, Debbie.
All right. Thank you very much. Bye-bye. Bye-bye. Nice meeting you, Elizabeth.
You too. Thank you.
You're welcome.
Take care, everyone.